Hello everybody, I'm Chiara from Spezieria Palazzo Vecchio and today I'm going to talk about diabetes and hyperglycemia. Diabetes is a disease that is characterized by a condition called hyperglycemia, that is the increase in blood glucose levels. This condition is caused by an absence or deficiency of insulin. Insulin is the hormone produced by pancreas that lowers the level of glucose in blood, ensuring that glucose is taken up by our muscle and fat cells and therefore does not remain in circulation. In Italy, more than 3 million people suffer from diabetes, and in 2014 there were more than 20,000 deaths from diabetes. However, a distinction must be made, because there are two types of diabetes. Type 1 diabetes is when the cause is autoimmune, that is, the immune system destroying the pancreas cells gradually causes the total absence of insulin production. In fact, in this case, the hormone must be administered from the outside through injections. In type 2 diabetes, on the other hand, the causes are often genetic, associated with acquired or environmental factors, responsible for an insulin deficiency, which is generally associated with its lower efficacy. So, insulin in this case is produced, but it is not effective. So, a condition called insulin resistance occurs, because body is like resists its action. In this type of diabetes, an important role is played by excess body weight. In fact, obesity or overweight are among those factors acquired over time that determine insulin resistance. In this case, it is not necessary to inject insulin from the outside, but the disease is treated with substances that mimic the hypoglycaemic action of insulin. The complications of diabetes are many because they involve different parts of the body, and they are due to the excess of glucose in blood. That is because glucose in high quantities inflames the tissues, produces free radicals and therefore oxidative stress. For this reason, the use of antioxidants is extremely important. Let's see which organs are most affected by this inflammation. At first, vascular cells. This causes circulatory problems, especially in the lower limbs. In fact, in the most serious cases of diabetes, the vessels are so damaged that blood does not circulate until it leads to gangrene. Ocular microcirculation is also impaired, and that leads to retinopathy. Another target organ is kidney. A highly inflammation-damaged kidney excessively filters important plasma protein, such as albumin, and thus kidneys will make a greater effort to reabsorb them. The stress suffered damages them to the point of leading to chronic renal failure. Insulin resistance also increases the renal reabsorption of sodium and water, which in turn leads to an increase in plasma volume and consequently in blood pressure. So we will have hypertension and cardiovascular problems. Insulin resistance also causes an increase in triglycerides, a decrease in good cholesterol, and an increase in bad cholesterol. This is reflected in a faster arteriosclerotic process. Other frequent manifestations of vegetative dysfunction include the disorders of the motility of gastrointestinal tract. This leads to digestive difficulties up to gastroparesis, constipation alternating with diarrhea, or intestinal pseudo-obstruction. Therefore, to treat diabetes, it is necessary to act upstream, that is, to keep blood sugar under control so that these complications do not trigger, but at the same time, it is also necessary to act on the prevention of any side effect. At the beginning, I said that too much glucose in blood increases inflammation and therefore oxidative stress. Well, the antioxidant par excellence is Q10 coenzyme. Another antioxidant active ingredients are present in blueberry, which also has many other properties. In fact, a 2009 study by the University of Michigan showed that the intake of blueberries improves the control of blood sugar levels. Also, according to some World Health Organization monographs, it is a valid protector of capillaries and therefore of microcirculation. Thanks to the action of anthocyanin glycosides, it promotes the regeneration of rhodopsin, which is a protein that improves the quality of sight. Now I'm going to talk about another two plants. They are very, very important, and they are artichoke and chicory. They both contain inulin, a fiber useful in regulating the level of sugar in blood. They also have a lipid-lowering effect, both on cholesterol, since it inhibits the enzyme responsible for the biosynthesis of cholesterol, and because it increases HDL while reducing LDL. Well, we put all these active ingredients together in a single formulation so that they work in synergy. This formulation is called the Diablock, and it contains 60 capsules consisting of dry extracts of all the active ingredients I have told you about. Taking Diablock can be assessed in mild case of type 2 diabetes. In this regard, I recommend you to download the project data sheet from the link here on the left to take it to your doctor in order to evaluate contemporary taking or substitution to medicines. That's all for today. Thank you for being with us. Best greetings from Spezierie Palazzo Vecchio.